Horses are special animals, and their healing powers have been recognized for thousands of years. Today, we will describe how the early intervention of therapy will help children with cerebral palsy. We will explain how cerebral palsy affects children, introduce the therapy known as hippotherapy, and discuss how this benefits children. First, I will explain what cerebral palsy is. Cerebral palsy is a non-progressive disorder of movement, muscle tone, or posture that is caused by damage that occurs to the immature developing brain, most often before birth. Cerebral palsy's effect on functional abilities vary greatly. Some affected people can walk, while others cannot. Some people show normal or near normal intellectual capacity, but others may have intellectual disabilities. The disability may be limited primarily to one limb or one side of the body, or it may affect the entire body. Signs and symptoms may vary greatly, which appear during infancy or preschool years. In general, cerebral palsy causes impaired movement associated with abnormal reflexes, floppiness or rigidity of limbs and trunk, abnormal posture, involuntary movements, unsteady walking, or some combination of these. People with cerebral palsy may have reduced range of motion at various joints of their bodies. Due to muscle stiffness, they may also have problems swallowing and commonly have eye muscle imbalance, in which the eyes do not focus on the same object. Brain abnormalities associated with cerebral palsy may contribute to other neurological problems. People with cerebral palsy may also have seizures, intellectual disabilities, or mental health conditions. It is important to get prompt diagnosis for any movement disorder or possible delays in your child's development. See your child's doctor or if you have questions or concerns about episodes of loss of awareness of surroundings or abnormal body movement, abnormal muscle tone, impaired coordination, swallowing difficulties, eye muscle imbalance, or other developmental issues. Cerebral palsy is caused by an abnormality or disruption in brain development, usually before a child is born. In many cases, the exact trigger is not known. Factors that may lead to problems with brain development include mutations of genes, maternal infections, fetal stroke, infant infections, traumatic brain injury, or lack of oxygen. Most cases of cerebral palsy cannot be prevented. The brain disorder causing cerebral palsy does not change with time, so symptoms usually do not worsen with age. However, muscle shortening and muscle rigidity may worsen if not treated.